So this is part 2 of the video that I did on Sunday, dissociative amnesia, identity disorders, dissociation, blacking out, zoning out, all dissociative disorders I covered in the previous video. So I'm going to post it in the cards as we go along. You can go back and check that out. But in today's video, I want to give you some ideas as to how you can manage dissociation on your own. And this doesn't mean you have to go in for psychotherapy. Not every individual who dissociates needs to go into psychotherapy. As a matter of fact, when there's family trauma, when there's intergenerational trauma, when there is unresolved conflicts in the family system, it's really easy for you to dissociate because that's the only safety zone, the only place that you can go to when you feel threatened. You know, it's your safe place. Some of us dissociate even with intense stress and no history of trauma. So there is a normal piece of dissociation, and it doesn't have to always be clinical. So in this video, I'm going to highlight some ways that you can kind of cope at home. But before we do that, let me briefly introduce myself in case you are new. My name is Tamra. I'm an internationally and board certified trauma therapist. I'm licensed in mental health. I specialize in treating children, teens, and families, as well as adults who are dealing with trauma. Let's jump in. So I've done a pretty good number of videos on this channel discussing dissociative identity disorder and dissociation. So I'm not going to touch that in this video. What I'm going to do is link my most recent video right up here for you. Go ahead and check that out at the end of this video. I'm also going to link on the end screen, which is the very last screen that you're going to get on the end of my video. I'm going to include some other videos there that may be helpful to you. So I'm not going to touch what dissociative identity disorder is, what dissociative disorders is, because you can find that in the previous videos. I'm going to highlight what you can do to kind of cope with dissociation at home. Now let's start with the first therapeutic tool. The first therapeutic tool is reflection. In the previous video, and here it is right here, I gave you the idea of drawing a line down the middle of your page and creating two different sections and writing down in one section what it is that triggers your dissociative disorder or your dissociative behaviors or symptoms. And on the other side, I encouraged you to write down what actually clicks you back into reality. And that could be anything. It could be if you're dissociating in the shower, it could be cold water coming on, right? You've run up all the hot water. If you're driving, it could be stopping at a red light or a stop sign that clicks you back into reality. Whatever it is, you want to write it down on the opposite side of how you dissociate. And what this is going to do is not only normalize this process for you, but it's also going to help you identify what's going on with you, right? You might find yourself saying, oh my God, I dissociate driving home. I dissociate in the shower. Absolutely. And so this is like a reflection technique that can kind of open the door for further exploration. Now, the next thing is something known as grounding. Let's say, for example, you are experiencing dissociation. You are experiencing kind of going into a different mindset or different emotions, or you are detaching from the present moment. The way to get yourself to come back is to process and engage in the process of grounding. Grounding is really being seated in the here and now, and you can snap yourself back into reality by engaging in grounding. And you want to use your senses, right? So when I'm seeing kids for psychotherapy, I teach them grounding all the time. I will say to them, what do you hear right now in this moment? And I'll get really quiet. And they'll say to me, crickets. And I'll say, very good, very good. What do you see? Can you find me 3 orange items in the room? And they look around, and they're looking for orange. Here it is, Miss Tamara. I'm like, good job. Now, what do you smell? And they'll pause and they'll say, I think I smell flowers. I'll say, good job. It's my plug-in over there. And then last thing I'll ask them is, what is touching your skin? And they'll say, my shirt, my pants, my boots. And I'll reinforce that positively as well. So I'm getting them to kind of tune in to where they are in the here and now. You can do this with yourself. You can pause. If you feel yourself immediately detaching from reality, you're going to really have to learn when you're getting ready to dissociate so that you can know to do this ahead of time. But you can do it alone, okay? But you just have to practice. So, you would say to yourself, what am I hearing right now? I'm hearing my radio. What am I seeing right now? I'm seeing my camera. I'm recording a YouTube video, Where's Pink? Well, Pink is over there. My stick-it notes, my whatever you call those notes, notepad. And so that's grounding, right? It's getting you to focus on the here and now. It's excellent. Kids love it, at least the ones that come in my office. The next thing is known as progressive muscle relaxation. And that's a huge word for squeeze and release. That's really what that is. Progressive muscle relaxation. I'm going to squeeze my fists really tight to get myself to come out of that dissociative state and really be present in the moment. I'm going to squeeze my fists and then I'm going to release. And I'm going to do that over and over to get myself to come back to reality. It's really causing your mind, your brain to focus on another part of you so that you're not in here. You're not in here. You're actually focusing on the sensation that's happening in your body. The next thing is known as mindful eating, breathing, and journaling. And I use this with clients as well. Mindfulness is the idea that you are mindful in the present moment of what you are doing. And so if you're eating in a mindful way, here's what you would do. You would get whatever food that you're eating. I usually like to help kids practice with candy, or sometimes I'll have them chew bubble gum, and I'll ask them to focus on the sensation that they are feeling in their mouth. So the gum is a little sticky, right? It's a little sour, tarty kind of a taste, or it's a little cherry taste. So how much longer before your gum, for example, turns into a soft state, and they'll start timing it, right? Some people use almonds, right? They want to taste that texture. They want to bite into the almond. While you're doing all of those things, you want to remind yourself where you are and what you're doing. And so that's mindful eating. Now, mindful breathing is really closing your eyes and focusing on how you are breathing, right? Am I breathing too fast? Am I shallow breathing? Am I hyperventilating? My God, hyperventilating, right? So you want to be able to ask yourself those things. Am I inhaling to the fullest of my ability? Am I exhaling completely, right? So you're being mindful of what you're doing. Mindful journaling is another thing, right? So you are journaling and you want to look at what you're writing. You want to be able to reflect upon what you're writing and really get it into your mind, what you're trying to get across through words, right? You want to focus on the sensation of your hand and the pen or the marker that you're using, and you want to touch the paper and feel the paper that you are writing on. All of those things are sensory based. That's really what I'm targeting here. It's all your senses, and it's a really good way to kick yourself back into reality when you get stuck. Yoga is another thing, physical activity, right? Jogging, running, all of that. When I'm exercising, I really like to exercise with shoes that allows me to kind of feel the sensation of my workouts and really gives me that cushioned kind of comfort, So you can actually engage in yoga, aerobics, Zumba, and dance and really center yourself on all the sensations your body is feeling. You can also really zone into the muscle that you're trying to work in your body as well. Write down your safety plan or your safe space. I have, my clients do this all the time. Sit down, write the sentence, I should say, my safe place, and really draw what your safe place will be or what it would be. For example, is it the beach? Is it sand? Is it the ocean? Is it somewhere in the clouds? Is it heaven? What is your safe place? And really draw it out to help yourself feel like you are there. Okay. And that's another mindfulness technique. It's also another coping technique for dissociation. It really gets you in the present moment. Pursue psychotherapy, but two specific kinds. One is EMDR, and the other is neurofeedback. And basically what's happening with these two techniques is it's sensory based, and it's really targeting what's going on with your emotions, what's going on in your mind, what are the sensations that you are feeling in your body. These are all techniques that you can actually use at home. You can actually buy a book in Barnes & Noble, on Amazon, on EMDR and how to do a couple techniques at home. So I encourage you to do that. And you can also pursue a psychotherapist who's experienced in EMDR and neurofeedback as well. Thank you so much for being with me in this short video today. Go ahead and hit that subscribe button and that bell button if you want to stick around and get more videos like this. And let me know in the comment section if you think that you can use any one of these techniques. I'll see you in the next video. Bye-bye.